Dr. Nurse. Science, Politics, and the Transformation of American Nursing. By Dominique A. Tobbell. Published by the University of Chicago Press. Introduction. The U.S.'s more than 3 million nurses represent the largest segment of the U.S. healthcare workforce. They are referred to as the backbone of the American healthcare system, spending significantly more time interacting with patients than any other member of the healthcare team. They provide care in a variety of healthcare settings, including hospitals, community health clinics, long-term care facilities, and in individual homes. As the World Health Organization notes, nurses and midwives are often the first and only point of care in their communities. The nursing model of care, which centers on the nurse-patient relationship and on improving health among individuals and communities, is underpinned by a distinctive body of knowledge. For the past 60 years and more, nurses have conducted research, contributing to that body of knowledge that has shaped healthcare practice, informed health policy, and improved health outcomes. Yet, in the early 21st century, many people, including those who work in healthcare, are still surprised to hear that nurses do research, and that this research is underpinned by a distinct body of knowledge, nursing science. Furthermore, relative to other types of health science research, nursing research is poorly funded. And nurse scientists, nurses who have also earned a PhD, either in nursing or one of the biomedical, behavioral, or social sciences, often reflect on the importance of identifying themselves as scientists rather than as nurses, in order to be taken seriously as researchers and avoid conflict with their physician research collaborators. In other words, despite more than half a century of experience as researchers, nurses' status as scientists is still contested. Dr. Nurse describes and analyzes what I am calling the academic project, the efforts of American nurses to establish nursing as an academic discipline and nurses as valued researchers in the decades after World War II, and considers why, in the early 21st century, that academic project remains incomplete. This history provides a valuable perspective on major changes that have taken place in American healthcare in the second half of the 20th century. From the 1950s through the 1980s, these academic nurses engaged in an epistemological project to construct a science of nursing, distinct from that of the related biomedical or behavioral sciences, that would provide the basis of nursing practice. They did so not only to develop science-based nursing practice amid the broad-scale
Sample complete. Ready to continue?